Welcome to the Keep It Simple training series on medical billing. In this video, we're going to discuss entering charges and copays. Hi, my name is Janice Humphreys, and if you're interested in anything related to medical billing, please visit our website at medicalbillingguide.com. And if you're on a budget, be sure to sign up for our free email tips that will save you time and money. Just click on the link below this video to sign up. So, is medical billing right for you? Well, these videos are intended to give you a bird's eye view of what a medical biller actually does every day, which may help you decide if this is a field that you will be interested in pursuing, because there's no sense running if you're going down the wrong road. So in this task, we're going to discuss coding for the services rendered. So medical coding. Well, medical coding is really the most complex part of the medical billing process. And this complexity varies by specialty. Some specialties are very easy to code for, others are more complex. Coding books are your friends. You must have coding books or some kind of online coding tools to use when it comes to coding your charges. And your source documents will be a super bill or fee slip or the chart note. And remember that only certified medical coders can bill from chart notes. So here's an example of the upper portion of a fee slip or super bill. It has the name, the procedure codes, diagnosis codes on it. You would receive this from the practice when you were picking up your information from the office. And so now we're going to switch over to looking at software to see how you would be coding your charges and entering a copay. And for a better view of the following software demonstration, be sure to click on the full screen button here. I've opened TotalMD medical billing software. This is the software we use in our medical billing service. It's very easy to use, and I'm going to demonstrate entering a charge and a patient payment. And I will be using one of the easiest examples of coding, and that's for a mental health professional. So I'm going to click on the ledger, select the patient. This is all sample data. And I would assume that this coding information is being received on a super bill, not from a chart note. And you saw a sample of the super bill in the PowerPoint. But typically a healthcare professional would provide you with a weekly list of patients, most likely, and that's because the CPT codes are limited and the diagnosis codes don't change much. So the coding is quite simple. So I'm going to enter in a new transaction. Click in the date field, and let's just enter a date. Let's assume the patient came in on this date, and the patient was seen for 1 hour of psychotherapy, which is a procedure code 90837. No modifiers. The amount is pre-populated when we set up the CPT code list. It's 1 unit. The place of service is 11, which is the office. Now I'm going to enter in the diagnosis codes, and these were given to me by the provider. This is major depression, affective disorder, single episode, and panic disorder without agoraphobia. Again, this is information that I would receive from the provider. Now I want to enter in a patient payment. The date of the deposit is going to be the date of service. I'll enter in the check number. This is a check. The patient paid $15, and I'm going to apply the $15 to that charge and hit the F3 key to save it. And you'll see that the charge appears in black and the patient payment appears here in green. And that's how you enter in a charge and a payment. So remember, when learning something new, ask yourself this question: how do you eat an elephant? One bite at a time. So be on the lookout and tune in for more how-to videos about medical billing, low-cost software, coding tips, finding jobs, or starting a home business on a budget. And remember to sign up for special email tips that will save you time and money. Just click on the link below this video to sign up. and be sure to stay tuned for more of our Keep It Simple series on medical billing.